retractors, okay? And let's talk just a little bit about those. When we think about retractors, I love these retractors, and I'll kind of show these up close a little bit later, but notice they're double-ended. Do you see that? This one is what we call a C, and the C is really wide and opens up. What we're going to be thinking about is how can we slip that in the patient's mouth, and we're going to have her pull open here in just a minute. But again, notice this is the C. Now, when we think about buccal shots, we've got what we call the Y. The Y, you can see, kind of goes back almost like an alligator. You see that? And so a lot of times the doctor will request us to take the buccal shots, and we're utilizing certain retractors that make it really tough for us to get back and get to that first molar. And so that was kind of a thing that my doctor said is, Shannon, by using these retractors, I don't think we're going to get back far enough. And so I told him, I said, we can watch. I think we can really get back to the first molar and second molar on certain patients. So I love using these. Again, C and Y. And I'll share with you in a minute as we put these in Kylie's mouth is the further outside the mouth always, and you're going to hear me say this a lot, the more stability you're going to have. And I've had patients come in with really long fingernails, and as we're taking the photos, I'm like, what is that in the picture? It was their fingernails, right? So the further that they hold these out, if you can imagine, the more stability we're going to have. The other thing is they're going to be our patient today. Kylie is our patient. When we get into troubles where we've got one assistant, we got a doctor prepping in another room, and we got another assistant that's going to have to come in and help us. Notice, I don't have an assistant. Kylie is my assistant. Why is that important? Because the assistant could be with the doctor in the other room. This is where efficiency comes in. I want to train you from the very beginning. Utilize the right armamentarium, the right retractors, the right mirrors, the right contrasters. You won't need anyone else. Practice is going to make perfect though. If you take sporadic images, one a week, you're never going to get this down. And everything in dentistry is repetition, all right? So now let's put this down for a few minutes and let me show you this other retractor. This one here is probably the #1 seller, but I can tell you that if you have these in your practice, they're really only good for a 6-year-old, an 8-year-old. So notice here what we have, okay? Double-ended, but let's talk a little bit about these. You notice how much wider this one is than this one? What happens with this one is the lip collapses. Here, I've got enough of this opening here where I can really get the patient's cheeks out of the way and they can open wider. The other thing is, remember, again, this is the C side. This is going to be the Y side. I don't really have a Y over here. So I'm going to have to think about what retractors would I use in order to get my buccal views. So I've got to use probably a different retractor for that. So I love these because the less material that I can use or less equipment, the better my image is going to be, okay? So Kylie, now I'm going to slip in this one. And this one's going to be just a little bit bigger. You got a teeny tiny mouth. But now I want you to close a little bit. Look at that difference. Bring your chin down some so this way they can see that. Do you see what happens? I really got to pull on her cheek for this one. We're here, and it might sometimes be a little bit uncomfortable because she's a little bit younger, but notice the difference. So I'm going to slip this one in again. You did such a good job. We're going to do it again. And then I'm going to slip this one in, and you're going to be such a pro by the time we're done today. Okay, Kylie, I want you to take your hands, okay? You don't have to pull it out that far back. There we go. And I want you to bring them as far back as you can. There we go. Perfect. Bring your head towards me, and I want you to let go for just a minute. Okay? Notice here how far out they are. You see that? So the beauty today is that we're going to be able to really, again, I don't want her to hurt herself, but I want the patient to be my patient. The other thing is that notice a lot of times patients will put them in far back like this, and I want to pull them forward. What that's going to do is really open up the buccal corridor and get some really good images going all the way back. So hold this for me, again, right there, and bring your hands further down to the end. The other thing is now this is my guide, nice and straight across, right? Everything's nice and parallel. I want you to close just a hair more, a little bit more, right there, and open just a little bit. This is called our separated view. We're going to look at her incisal edges. We're able to really look down that buccal corridor so I can see, and this is slightly open. You really want to see just almost like I'm going to get the tip of my finger in there, okay? and close just ever so slightly. Perfect, perfect. So let's pick up our camera. Remember, we're still on standard mode, right? Just gonna activate it. And I'm going to come now. Again, Kylie likes to turn her head a little bit. Right there, okay? And Kylie, beautiful. Stay just like that for me. Great job. I'm gonna take one more where maybe I came this way and didn't quite get it so they can see the difference. You see how I wasn't dead on, okay? I wasn't dead on. I'm more at an angle. That's not what I'm looking for, all right? What I wanna do, look here, over too far, right? You see the difference? Got to tip down, over too far. So let's really take a good one. Great job. And I'm going to come in just a little bit. Beautiful. And thank you for being so patient, sweetie. Now what I want you to do is I want you to bite together with those in. Is that on your back teeth? Everything's together? Okay, and maybe we can have the camera bite down all the way, come in just a little bit. And now what I want you to do is stick your tongue up against your teeth. Almost like I can see it. No, no, no. Back in. Bite down. And just push your teeth. Put your tongue right on the back of your teeth. Right then. There you go. You see how if she puts her tongue and pushes it, we're going to start seeing a lot of saliva and things like that, right? So make sure your patient pulls their tongue back just a little bit. Go ahead and move that tongue out of the way. And go, okay? The other thing that I would do is if I see any bubbles, I would take my air water syringe. Okay? You're doing great. Teeth are together. I want to make sure I'm open, close, open, close. Now, stay just like that. Don't move. Okay? Now I'm able to turn her head just a little bit more. Notice the retractors might have moved ever so slightly because we're making you hold that. Perfect, honey. There we go. Awesome. Make sure that it's right on. Again, really nice, right? Let's stop here for just a minute and let me just kind of talk about one little thing. As we're going through, we took a little bit of time doing that, right? But remember, repetition. You're going to get really, really good at this really fast. I also always want to make sure that I am ready. I don't want to get up and have to go get retractors and mirrors and things like that. The other thing is that Kylie was the patient. Remember, she's holding the retractors. So again, going back to that, use your patient for the very reason. The other thing is always making sure, regardless of the camera that you're utilizing, that you're nice and straight across. Nice and straight across. Patients now will start to get tired, although you did really good, and they'll start to open. So what we want to make sure of is they're definitely open, close, and that they're biting on their back teeth. Again, really important, okay? So now I just want to show you one more little thing with this and why this is so important with these retractors. When we utilize retractors that are wire, a lot of practices, these retractors we'll use for our mirror shots, but a lot of people just stick with the same retractors. Notice that they're metal, okay? The other thing is when you put these in the mouth, they're cold. And you know, they're a little bit cold, so she's gonna put them in and she's gonna feel that today. The other thing is that I wanted to share with you how we're going to get a collapse right in the center, very different than what we had with the clear. My eye is going to want to go to those wires, and that's what I want you to see the difference today, is nice and clear. So again, your eye is going to go to the teeth and no distractions from the wire. So I'm going to have Kylie put these in. This will be a little bit easier. Okay, so I'm going to slip these in just like that, and I want you to hold them for me, okay? Do you see the difference? This is important because when we use wire, I didn't get that nice curvature. Okay, this upper lip is collapsing on her teeth. Remember, the most important thing is she's going to an orthodontist, but what if we were sending her to the lab and the lab needs to see the gingival architecture? Maybe you're going to utilize a laser. There's lots of reasons why we don't want that. We want to see all the tissue, okay? The other thing is even if we slipped it, and let go of that for me, I'm going to slip and go here, even if we use the larger end, because you may be saying, well, Shannon, why didn't you just put in the larger end? We're still going to have that issue. Hold that for me. You see? She's also constricted. Do you remember how far out she had those other retractors? This is really important. So we're going to put these aside and really only utilize these for our mirror shots. Now, what I want to show you is exactly how we can capture images. Let's say if you don't want them to stand. So what I've done is I've asked our patient today to sit on the edge of the chair and just kind of let you know that this is another option. So I can hold the camera up and still get a really, really good image here. So you could do the same if you needed to. You could have them come and sit in the chair. So again, if Kylie was really tall, I would maybe have them come and just sit on the edge of the chair and make sure that we can get the same image, okay? Now let's talk a little bit about her being in the chair. When we also think about going back to exactly what we talked about, right? Coming in and being efficient. I had her stand, I took the smile shots, I took the tip down, I took the E shot, I took retracted views because I was trying to be efficient. What happens if our room is really small, and I've worked in really small ops? We can have her come to the chair and you can sit knee to knee with them and get the same images. We might have to adjust the chair a little bit, but that's another option for you. Also, just remembering going back to what if the patient is really tall, right? A tall male, a tall female. I don't want to be shooting up. I also don't want you to be shooting down. So we want eye level to make it really nice and straight across. But again, the best thing about this camera is we've got that grid. So now let's lay Kylie back and let's get our mirror images, which is the hardest to get.